The Disruptive Dozen is a rank-ordered list of 12 closed-to-market cutting-edge technologies that leading Mass General Brigham faculty feel will have the greatest impact on healthcare in the next 18 months. Number 11. Video games for stroke patients. Strokes are a major source of disability in the U.S. and around the world. Following a stroke, patients often must undergo intensive physical and cognitive therapy in order to regain functions that have been lost or impaired. But this can be a long, difficult journey that tests patients' fortitude and their wallets. For the last several years, researchers across the globe have explored ways to reduce the barriers to stroke rehabilitation. Now, clinicians are increasingly turning to video games, from standard consumer units to sophisticated virtual reality systems, to help increase patient motivation and compliance, as well as increase access to rehabilitation services. Such game-based rehabilitation can help patients retrain arm and leg movements following a stroke. For example, a North Carolina-based medical device company has developed a suite of virtual reality tools that simulate real-life daily activities so stroke patients can work on recovering self-care skills. Patients with impaired limb mobility can practice simulated tasks such as lifting, carrying, and manipulating virtual objects. With repetition, such activities can help stimulate the brain to forge new neural connections, which is thought to be a major driver of stroke recovery. Although enthusiasm for these virtual reality-based systems for stroke recovery is high, it should be noted that these tools are currently meant to supplement, not replace, conventional in-person therapy. And clinical studies aimed at assessing these tools' effectiveness have so far yielded conflicting results. Nevertheless, researchers are working to bring clarity to this area. That is because stroke care represents a significant source of healthcare spending, costing the U.S. over $30 billion a year. And that figure is projected to soar in coming decades, underscoring the need for innovations that can help decrease stroke recovery costs.
There are two really interesting parts of how we consider using virtual reality-based tools to help people recover and enhance what they can do. In the area of stroke, gaming technologies and virtual reality technologies have recently been shown to be virtually approximate to therapies for upper extremity stroke. What we can do then is deliver mass practice to people, delivering more to many and changing the world. In the area of limb dysfunction, virtual technologies are also enhancing sensory impairment as well as motor impairment. So these kinds of interventions have a near-term and then a long-term benefit. And we're just starting to understand who might benefit the most, how we can deliver it, and what are the worldwide implications of delivering mass practice to many.